Hello and welcome. Once you confirm that I am audible, I will start.
Yes, sir, you are audible.
Okay, thank you. Now today we have told that we will take on idiosyncrasy. So aphorism number 116 we have completed, and today we will go to 117, which basically deal with idiosyncrasy. Actually, this is a paired aphorism. 116, you can tell that this is a preamble for 117. We have underlined very few healthy bodies, and then later on in 117, go to the later category. That means those very few healthy bodies. We'll start from this. Can you read this?
Sir, 117.
117.
To the latter category belongs the so-called idiosyncrasies by which are meant peculiar corporeal constitutions which, although otherwise healthy, possess a disposition to be brought into a more or less morbid state by certain things which seems to produce no impression and no change in many other individuals.
Stop here. Okay, underline to this later category means there are only few means less percentage of people who seem to be affected by those things, which is not affecting others, right? The smell of nose rose causing sneezing. Okay, the peaches
Yes, sir.
causing sneezing or peaches causing a reaction in some persons. Okay, these
Yes, sir.
persons are what? Peculiar corporeal constitution. That means a peculiar constitution, corporeal bodily constitution. This is a way of writing. You should overpass this. Peculiar corporeal constitution means a peculiar constitution. Why it is peculiar? Because it is being affected, that person is being affected by such things which seem to produce no reaction in other people. That is why they are peculiar. But they are not unhealthy persons, they are otherwise healthy. Otherwise, except these idiosyncrasies which they are having, they are otherwise healthy. Okay, although otherwise healthy, poses a disposition to be brought into a more or less morbid state. What kind of this morbid state may be? Some people will faint, some people will start sneezing, some people will have a peculiar arterial eruption, some people will have diarrhea. Okay, to in reaction to these things. Okay, now you will get confused with uh, allergy, oversensitiveness, and idiosyncrasy. Okay, oversensitiveness, idiosyncrasy, and allergy for all the practical purpose, because our class is for the clinical orientation. For all the practical purpose, these, please consider all these same. Okay, for
Yes,
all the practical purpose, these, please consider these as the same. Okay, but there are some differences. Now you will see some constitutions is being affected by everything. They cannot take cold, they cannot ride in the air, open air, they cannot have peaches, they cannot have fishes, they cannot have eggs. You ask them to report for a blood allergy test and they will show lots of allergies in their food. So what to take? You cannot ask patient to stop taking everything. So these kind of constitution, for idiosyncratic, there must be only one or two things which is affecting the person. Okay, but for allergic diathesis, that means a peculiar state where the person is being affected every now and then from something. That is actually a feeble constitution. Okay, not the idiosyncrasy, and that is you can treat homeopathically very well. Okay, Now go to Kent idiosyncrasies chapter. Idiosyncrasy chapter Kent. Kent with you?
हाँ सर एक मिनट.
Okay. Chapter number 29.
हाँ सर आप बोलिए मैं सुन रहा हूँ.
Okay. Please read it.
सर मुझे मेरी बुक मिल नहीं रही है, एक मिनट.
Okay. Take your time. If you have your book, it will be very easier for us.
Yes sir. Sir, give me 5 minutes.
Okay.
सर
Yes.
सर मुझे स्टुअर्ट लॉ से रॉबर्ट मिल गया, पर मुझे केंट एकदम से नहीं मिल रहा सच्ची में.
Okay. Okay. छोड़ दीजिए इसको. आइए. I will just read it out. Just listen carefully. Idiosyncrasies, you can later follow up with the recording. Okay. So,
Okay.
idiosyncrasies chapter. The study of idiosyncrasies is closely related to homeopathy. The usual explanation of the term is an oversensitiveness to one thing or few things. You should underline that. Okay. One thing or few things. It does not apply to the general susceptibility in feeble constitutions. Okay, that is a general susceptibility in weaker constitution. That doesn't mean the idiosyncratic constitution. Idiosyncrasy will show itself with only one or few things, not to everything. Okay, in those feeble constitution where the patients are susceptible to all things, over susceptible and over impressed by simple annoyance. In old school, now this first two sentences will separate our idiosyncrasies from those feeble constitution. Having allergic diathesis, always eosinophils, you will see in them eosinophils are always at the top. Okay, so these are the allergic diathesis which is getting affected every now and then by everything. Okay, that is not actually idiosyncrasies. To be idiosyncrasies, it should have only one thing or few things. Okay, now this oversensitiveness to certain things, why it is happening? Because there is a peculiar kind of susceptibility. This idiosyncrasy can be acquired, okay, in chapter oversensitive patient, Kent, Kent philosophy, oversensitive patient. Kent is telling that previous exposure to something, like the patient was not susceptible to dust before, but all of a sudden he went in a place where there are lots of dust, okay, for work purpose, and he cannot avoid that. Overexposure to that dust have made him oversensitive to that dust. Have you heard these kind of thing that डॉक्टर साहब हमको यहाँ पे तो नहीं होता था, बट हम काम के लिए उस जगह पर गए, वहां इतना डस्ट था कि एक साल के अंदर I developed this type of thing. Okay, so this is oversensitiveness. Have you heard this?
Yes, sir.
Hmm.
Or when people change places, they say that they are having diarrhea or constipation due to change of water.
Okay. Yes. Yes. That also. Oh, exposure to that is over exposure to that. एक दो दिन के लिए गए वहां पे फिर वापस आ गए वैसा कुछ प्रॉब्लम परमानेंट नहीं रहा उनको. But when they are overexposed to that environment, overexposed to that stimulus, they become sensitive to that. This is oversensitiveness developed after that. Okay. You will see idiosyncrasies to certain allopathic drugs. Okay, especially nowadays you will see patients who are susceptible to sulfur. Okay, people will come to you and tell you that I was susceptible to sulfur, so don't give, I am susceptible to sulfur, so don't give me medicines containing sulfur. Okay, people will be showing idiosyncrasies to certain antibiotics, and that will means perplex the allopathic physician that why this person, not everyone is susceptible to this kind of antibiotic. I know a patient who developed ototoxicity due to ofloxacin. Okay, ofloxacin is the commonest antibiotic used for any kind of multibacterial infections, whether it is throat infection, whether it is high fever, they are using ofloxacin. But in the bad effect of ofloxacin, there is ototoxicity. That means there will be some something wrong in the ear that will cause tinnitus. Patient after taking ofloxacin for his sore throat developed that tinnitus. When he complained, his physician, he told him that everyone is taking, why you are developing this kind of tinnitus? This might have some relation with your ischial tube, because there may be a blockage due to throat infection, and physician was correct in saying that. But later on it was found that no, there was no blockage of the tube, and it was purely due to ototoxicity of that ofloxacin. So certain antibiotics containing certain features which are being seen in only some individuals, not everyone who is taking the antibiotic. Have you heard about the unfortunate drug reactions? Okay, some drug patient took and developed a swelling whole over the body, and that is a physician will term as drug reaction. And these drug reaction is not common to everyone. Only some patient will develop it. Okay, there are idiosyncrasies patient will develop after some acute illness. Patient will develop that I was very good before, but after typhoid I have now become susceptible to that kind of food, or that kind of meat, or that kind of vegetable after typhoid. Okay, I am you know that every acute disease leave behind some crisis. Okay, now go to aphorism number 73. Aphorism number 73.
Yes, sir.
1, 2, 3, 4, 5, 6, seventh line. Seventh line. This in the beginning, Hahnemann is dealing with the individual acute disease. Now go to seventh line and read it.
However, they are generally only a transient explosion of latent sora, which
What is generally a transient explosion of latent sora?
acute disease, acute
Acute.
exaggeration on chronic disease.
Yes, you are right. Individual acute disease is transient explosion of latent sora. Next.
Which spontaneously returns to its dormant state if the acute disease were not of too violent a character and were soon quelled.
Now stop here. That acute disease causes a rise in the explosion of latent sora. Okay. Now, if that was not of a violent character, what will happen? Sora will go to its dormant stage again. Okay. So, what are the factors which is rising latent sora to explode? What are the factors which are causing sora to develop. This is one of the factors. Animal is telling overstress, grief, okay, any other kind of physical exertion may rise. This sora, which was dormant till now, okay, to explode and in a full-fledged chronic disease. Okay, some acute diseases are causing explosion of this latent sora. So we are telling that some acute diseases, individual acute diseases, is leaving the crisis behind. Okay, you will see that patient is complaining that after that kind of fever, I have developed the hair fall. My hair falling is increased after that fever. What is this? This hair falling, dry lusterless hair is falling. It is one of the we have read in our previous classes. You can refer to the lectures recordings, that this is one of the symptom of sora. So after that acute diseases, hair is not stopping, constantly falling. This is what acute disease have caused. It has caused explosion of sora. What we are going to treat now? We are going to give the treatment with the antisoric remedies. Okay. So this individual acute disease is causing explosion of sora. So patient developing the this idiosyncrasy after so and so acute disease, what it indicates? There is sora in the bottom. Okay, there is sora which is causing this kind of oversensitiveness. Clear? Now, next, there are acute miasms which sometimes leave a stamp behind. Chicken pox. What are acute miasms? These from a particular form of expressions are there. Chicken pox. There is particular form expression. Every individual will have these symptoms only. No less. There may not be any symptom missing. Suppose 16 symptoms of chicken pox are there in the record, and patient will suffer from symptoms. Maybe all together 16, maybe 10, maybe 5, but from those 16 set only. This is called acute miasm. This is called a fixed miasm, fixed in its manifestation. So these kind of miasm, acute miasm, sometimes left behind their stamp. Okay, so after patient will tell, after typhoid I have developed this kind of oversensitiveness. This might be due to that acute miasm. After chickenpox I have developed this thing. This might be due to that acute miasm, or maybe due to the explosion of latent sora. Okay, clear? So this is acquired idiosyncrasies and very easily treatable. But those patients who are inherited with the idiosyncrasies, okay, are seldom treatable. Chronic idiosyncrasy, okay, since the very beginning of their life, they are oversensitive. They are oversensitive to these things. They are very. Some patients are that they will born with idiosyncrasy and die with idiosyncrasy. This is what Kent is saying. Okay, so this is idiosyncrasy. I hope you have understand what is idiosyncrasy and how to treat it. It is exaggerated reaction to few or some things which seem to produce no reaction in other apparently healthy individuals. Okay, if you can trace the development of this idiosyncrasy, you will be able to treat. Okay, like overexposure to certain kind of chemical, and you can antidote with highest potency of that chemical. Overexposure to mercury, you can antidote with your highest potency of mercury. Okay, clear?
Yes.
Now, okay, now come to 117 again. Next, there is a footnote which is containing some food items which is causing idiosyncrasies, that partaking of mussels, mussels, crabs, roe, barbel, these are all the seafoods. Okay, usually what we are forbidding our patient to take: brinjal, crab, prawn, These are the things which is causing some reaction in certain individuals. Next. Next पढ़िए.
नेक्स्ट मीन्स 117 के उसके बाद.
But this no that 117 complete नहीं हुआ अभी. But this
हाँ,
inability to make it.
But this inability to make an impression on everyone is only apparent. For as two things are required for the production of these, as well as full stop.
Okay. Only apparent underline कीजिए. Now two things underline कीजिए.
Yes.
What are those two things? The inherent power of influencing substance. Underline कीजिए.
Yes,
Inherent power of influencing substance. Next, capability of vital force that animate the organism to be influenced by it. Vital force should have so much disposed that it can be influenced. Okay. Number one thing, inherent power of the substance, influencing substance. It will not change. It is a constant here. There is an inherent power in that thing which is influencing. It is a constant here. What is varying? What is varying? Varying is the capability of the vital force to be influenced by this. This is varying. So two things are required for anything to impress on the constitution. What is those two things? Influencing, inheritance power of the influencing substance. It is a constant. नमक है तो नमक ही रहेगा, चीनी है तो चीनी रहेगा. Okay. It is not change. It is not changing in its characteristics, but the power of the vital force to be influenced is variable. Okay.
Yes, sir.
If the power of vital force is that it can be influenced by that substance which is not producing any result in other healthy constitution, but this vital force, this particular vital force is being affected by this. Okay. So this particular vital force, we are telling that this is what? Idiosyncratic.
Yes.
Okay.
So that second,
next,
the capability of vital force is susceptibility.
Capability
Of vital force is
susceptibility to that particular person. Okay, susceptibility to that particular substance. Clear?
Yes, sir.
Okay, next पढ़िए.
Influenced by it, the obvious derangement of health in the so-called idiosyncrasies cannot be laid to the account of these peculiar constitutions alone, but they must also be ascribed to these things that produce them, in which must lie the power of making the same impression on all human bodies, yet in such a manner that
Underline कीजिए.
yet in such a manner that but a small number of healthy constitutions have a tendency to allow themselves to be brought into such an obvious morbid condition by them.
Okay, underline कीजिए इसको. A small number of healthy constitution have a tendency to allow themselves to brought into such an obvious morbid condition by them. Okay, only a small, and those is small number. Last 116 ka last line, very few healthy bodies. Okay, those small number which are allowing them to impress. This is idiosyncrasy. Okay, next पढ़िए.
That these agents do actually make this impression on every healthy body is shown by this that when employed as remedies, they render effectual homeopathic service to all sick person for morbid symptoms.
Underline this. When employed as a remedy, they render effectual homeopathic service to all sick persons. Okay, underline this. Next, नेक्स्ट पढ़िए.
To all sick person for morbid symptoms similar to those they seem to be only capable of producing in so-called idiosyncratic individuals.
Okay, now what he's telling about that this inherent substance to influence everyone is proved by this when these kind of symptom, what is the one of the benefit of idiosyncrasy?
They, while proving they give symptoms in higher potency, they give peculiar symptoms which are useful in treating all the sick people who give that symptoms.
This is one of the benefit of idiosyncrasies, and this is which observation of Kent?
Prover proves every remedy. For observation 8.
Yes, aphorism number observation number 8. Some people prove everything they get. Some people prove everything they get. Okay. Observation number 8. So this is what we are getting by this. This symptoms we are collecting from these idiosyncratic individual actually helping us to treat these symptoms if found in some other. Like in footnote, Hahnemann is giving example of Rose, where Princess Maria have treated his brother or father, whatever. There is a mistake in translation, you might be knowing, but that is not in for discussion. This is only for academic purpose, not for the clinical purpose. The thing is that the rose water is producing idiosyncrasy in some persons. Rose water is causing faint, rose smell of rose is causing faintness in some people, and that princess with the rose water sprinkling on the face of who was faint, and he was treated with that rose water. So it means that rose water has the capability of producing faintness, and it has the capability of treating faintness. Okay, but not showing everywhere when it is proved, but in some constitution only those are having capability of that or the capability of influenced by that. Okay, that is the two things. Okay, substance and the constitution, and this is small number of constitution which is giving us all the symptom, which is actually completing our proving. Like one of the symptom you can tell of some drug, there are altogether 12 symptoms, but last two symptoms have been observed only in one or two provers. Okay, these two provers have actually what they have done, they have completed our drug proving. Okay, otherwise if they won't exist, they were not there as a prover, we won't have those two symptoms. Those last two symptoms were will be missing in our materia medica. Okay, so this is one of the importance for idiosyncratic prover. So it is very difficult. Allergic state. Now how to differentiate between this allergic rhinitis and idiosyncrasy? Every time the person is exposed to cold air, and they'll start have a running nose. Every time the person is affected by dust, they will start running nose, and every now and then they are having running nose or coryza. This is a constitution called allergic rhinitis. This is a disease state which we are calling allergic rhinitis. Okay, rhinitis means running nose, allergic, due to some allergy. Their nasal mucosa is so susceptible that every now and then started running. Okay, so this allergic rhinitis is actually a deep miasmatic state. What we have read during our discussion on miasm from Robert's philosophy, you will see that it is not an easier thing to treat nowadays, and this allergic rhinitis actually are being more complicated with the anti-allergic drugs. You will see patients who are taking for years together a tablet of say Allegra, or say there are lots of anti-allergic tablets available in the market. Cetirizine, they're common. They are getting it over the counter and taking it every now and then for years together. What has happened here? This allergic rhinitis is actually what you will say, that is a mixed miasmatic disease, and it is in very constitution is very weak in these kind of sufferers. Constitution is very weak. Number one, multi-miasmatic disease, not an easier thing to treat this allergic rhinitis. Plus, what is happening? The drugs, the anti-allergies the patient is taking, it also masking up the disease. You have read the masked venereal disease, where the
Yes.
psoriasis is being complicated with treatment of mercury, and you will get in present days masked anti-allergic disease. Okay, what is happening here? The patient was suffering from allergic rhinitis, and patient used to take these anti-allergies. Now, plus over and above, they used to have that nasal decongestant, means nasal sprays, which is decongesting the nasal mucosa. They are having atropine, like that drops are available in the market, and they are used to that. And what this is causing further damage, permanent damage to the nasal mucosa, and causing atrophic rhinitis. You must have heard about this disease. Is one of the purely iatrogenic disease developed due to use of these nasal sprays. Okay, and these are very difficult to cure, because this is not this is actually killing the nasal mucosa. Atrophy of the nasal mucosa due to overuse of these sprays. You know that olfactory neurons are regeneratable, they regenerate, but if the nasal mucosa are atrophied, where they will get their stimulus from? Okay,
Yes.
so these kind of state you will get in your clinic every now and then. Stop these nasal spray as soon as possible for your patient. Don't ask your patient to stop those anti-allergies which he is taking for long, because it will aggravate the case and patient will leave you, will not stay with you. Stop these nasal spray at least. Ask the patient to take steam inhalation for 2 or 3 times daily, plus give your medicine. When you will see with the torch in the nasal turbinates, you will see the hypertrophy, you may see polyp, you may see DNS. Okay, so these are the thing which is causing this. DNS was causing one of the reason for this allergic rhinitis is DNS. Okay, that it is overactivating the nasal mucosa. Okay, what is DNS? It is actually deviation of the nasal septum. And what is it? It is actually the congenital, you can say it is a congenital error, and you can trace it back to syphilis. You will see that totally one nasal is totally closed by much deviation. So much deviation is there that one minute. One nasal turbinate has been closed, and you can trace it back to syphilis. Okay, there may be nasal polyp, or there may be hypertrophy of the nasal mucosa. So you can trace it back to psychosis. You see that this allergic rhinitis, how simple it was seeming to us, but how difficult it is. So don't promise, don't guarantee your patient a easy cure, but ask your patient to have patience. How long you are going to take these anti-allergies and these nasal drops? It will ultimately spoil your health and spoil your nasal mucosa. So now, what sort of medicine you can think of in these kind of allergic rhinitis? First and foremost, medicine for this is steam inhalation. Okay, ask your patient to take steam inhalation twice daily, morning and night at least, or 3 times. Okay, give your patient the anti-miasmatic medicine after taking the case. If the in acute cases patient is coming to you, give some sort of palliative, because you know that it is if at this period if you are going to give a chronic medicine for that patient, it may aggravate the patient. Okay, so give a palliative medicine. Not necessarily you will give Allium Cipa or like other drugs, but what is coming to at that time, you will see in these kind of allergic rhinitis cases that the patient is not complaining of burning, what we are seeing in acute cases, not complaining of burning, just sneezing. Paroxysm of sneezing is there. Paroxysm of sneezing is there. So you can prescribe one of the medicine for that palliative, Aurelia racemosa. You can think of match the symptom and you can give Aurelia racemosa in 1x or 3x potency. The next in line is the nasal cabinets are hypertrophied and patient is constantly complaining about the nasal blockage and have taken anti-allergies for long and have taken nasal sprays for long, you can go with Nux vomica itself. Nux vomica has a symptom of nasal blockage, which is aggravated in warm room. In room, it is aggravated. In open air, it is uh, coryza is ameliorated. Okay, so this is one of the Nux vomica symptoms, plus the crude drugs, bad effects of that drugs, and Nux vomica is coming.
Yes,
So
sir.
you can, but what should be the potency here? Because the patient is of feeble constitution, have suffered a lot, go for a lower potency, 6, 30, and
Okay.
go for a repetition. We will read how to judge the potency. We will
Yes.
discuss how to judge a potency and how to judge a repetition when we will come to posology. So here
Yes.
I'm just giving an example of just Nux vomica. The patient have suffered a lot, constitution have deteriorated, so don't go for Nux vomica 1m. It won't actually affect anything to patient, it won't aggravate, it won't palliate, it will do nothing in that kind of cases where the constitution is have become so feeble. So go for 30 or 6 and go for repetition one or twice for 3 or 4 days. Okay, so this is these patients need repetition and this patient need a lower potency. Okay, like Aurelia racemosa, I was telling that you should give it in 1x or 2x or 3x potency and repeat it daily for few days until the patient got relief. Next is coming in line is Teucrium verum verum. If there is a polyp, if there is, you can see a polyp in the nose. Number one, if you can see a hypertrophy, if there is no polyp but there is hypertrophy of nasal mucosa. Number two, if there is a tubercular diathesis in the background.
Yes, sir.
Hello.
Am I audible?
Yes, sir.
Okay. If there is a tubercular diathesis in the background, if there is a history of worm infection at childhood or many adult patients, you will see that are suffering from worm infection. Okay. So, and if there is a enlargement of these cervical glands due to constant allergic rhinitis, people may suffer from enlargement of cervical gland. Every allergic rhinitis patient won't suffer this enlargement of cervical gland, but if the patient is suffering from allergic rhinitis, plus you can, after palpating, you can see that there is an enlargement of cervical gland, you can go for Teucrium verum verum. What I have told, if there is a polyp on a clinical examination, if there is a hypertrophied nasal mucosa, if there is enlargement of cervical gland, if there is a tubercular history in the background, if there is a history of worm infection, okay, uh, plus if you are seeing a child of below 10 years, you will observe that the child is restless, cannot sit at a place. This is one of the indication for Teucrium. Though we are forming totality for these drugs in this fashion. Okay. For this, you have to do clinical examination. You know, you need to know your philosophy, you need to know your materia medica. Okay, it's
Yes.
not that easy for every allergic rhinitis you go and prescribe Allium cepa. It's not that.
Yes.
It's not like that. Okay, you have to justify every medicine you are giving. Okay, so we have discussed earlier. Nothing much to tell in Aurelia. It is small drug. You can give it for palliative relief only in 1x or 3x potency. We have discussed Nux vomica, where there is a history of anti-allergies, patient taking anti-allergies for so long. Next, and there is a symptom of nasal blockage, which is aggravated in a warm room and ameliorated in the open air. And we have discussed this teucrium. These 2-3 medicines, plus if there is some gastric symptoms, okay, along with this allergic, if there is some gastric irritation, symptoms of gastritis, you can think of histamine itself. Histamine is available in the LM potency with the internationals in Kolkata. You will get it. You can think of histamine. Why these medicines are coming to our mind? Because this is the condition where the patient have been suffering for so long. You need to bring the constitution. You need to you will say, you need to prepare the soil. Okay, prepare the
Yes.
soil before the application of seeds. Okay, prepare the patient for the polycrest, PPP. Prepare the patient for the polycrest. Patient coming, first time coming to you, you need to prepare the soil for permanently curing this patient. So these are the short acting medicines, or maybe these are the polycrest with the some sort of quick relief to the patient. But in this also, we are doing judgment with the philosophy and judgment with the clinical, our clinical knowledge. Okay, so histamine is
Yes.
one of the medicine which will come to our help if along with this allergic rhinitis there are symptoms of gastritis. Okay, and I don't know any other application of histamine, but this is one of the indication for this allergic diathesis. Clear? So we have
Yes.
discussed idiosyncrasies. Along with this, we have discussed a clinical case for allergic rhinitis. Okay, now go to 118.
Yes.
Okay,
Every,
please.
every medicine exhibit peculiar action on human frame, which are not produced in exactly the same manner by any other medicinal substance of a different kind.
Okay, so it is actually the individualization of drug.
Right.
Individualization of drug. Every medicine in its own peculiar manner. Okay. Now,
Yes.
one thing you need to know here, that we are of late classifying medicines as acid. Okay. One of the peculiarity, you often have been asked in your viva that acid group bolo or Cali group bolo. One of the peculiarity of this Cali group is short neck or easily influenced by that cold or fatty, chubby persons. Like this Cali group, a common theme running to that group, acid group, a common theme running to all these. Okay, but still,
Yes.
like this concentric circle, at the end, every medicine is separated from other. Phosphoric acid is different from acetic acid. But when it was like acids, okay, when you are just thinking of a crude acid, what it will do? It will burn. Whether
Right.
it is HCl, it is sulfuric acid or hydrochloric acid or fluoric acid, all have a common crude effect of burning. That is falling under here. That is here. But as the potency increases, they started to differentiate itself themselves. Okay, they
Yes.
started to differentiate themselves from other acid group. So as you increases the potency of that, they will show a different. You are giving acid fluor Q, it will have common effect with hydrochloric acid, it will have common effect with sulfuric acid. What sulfuric acid is doing, hydrochloric acid will do, and acid fluor will do. That is why we are grouping these acids together. Plus when we are ascending in potency, 30, 200, 1m, okay, they started to differentiate themselves. The acid floor will have a peculiar affinity of the organ. Acid floor will have a peculiar symptom of its own. Hydrochloric acid will have a peculiar symptom of its own, which will differentiate itself from others. Okay, so grouping is okay, grouping of the drug is okay, but we have to remember that every drug is individualized. Every drug will produce disease elements in its own peculiar manner according to eternal law of nature. Okay, from this onward, you follow the lecture I have shared before. From 119 to 127 we have discussed in the lecture I have shared last Wednesday. You will get it in study material. Okay, so just follow those lectures. If you have any question now, you can ask.
Uh, Sir, can you tell me a little bit about the repetition in LM potency? Like, if we want to give LM potency in acute conditions,
Mhm.
for chronic condition, I have seen like every day we are advising the patient to give 10 strokes and then take 1 cup of medicine, mix it in half cup of water, and then take 2 spoons or 1 spoon accordingly. So, if we want to give the patient LM potency in acute condition, then like we should tell every time to give 10 strokes, or like we should prepare one potency in water and then we should give from that water subsequently.
Both will do. Both will
Okay.
do. For easy for the patient, if you are ask means if you ask your patient that prepare every time, every 2 hour, every 1 hour, or every half an hour, it will sometimes irritate your patient to make these kind of medicinal solution. But you can do for easing the process, not better to give every time, make every time afresh. But for easing the process, we sometimes standardize it to make a half cup of water, and every time you take, stir it with means vigorously, stir it properly, and then take.
Okay.
After
Okay.
mixing it well, and then take. This will increase the potency a little bit. After mixing it well and take, in cases of migraine, I ask my patient to when they are having this kind of headache, they won't have these headaches every day, but when they are having this kind of headache, I ask my patient to prepare your medicine and keep it, and take from that every 15 minutes till the pain subsided. Okay, both will do.
Okay.
But to less irritate your patient, or for the comfort of your patient, you can ask half cup of water with the medicine and take from it after stirring it well. Okay, after
Okay.
mixing it vigorously. Okay,
Sir, yes, sir. Low potencies can be repeated very often.
lower potency can be
Can be
repeated.
repeat.
It depends. Repetition depends on the demand of the situation.
Hmm.
Okay.
So, if no,
Demand
like
of the situation.
we cannot repeat 1 m or 10 m very often. Like we cannot give that in acute cases. Can we give
1m. Higher potencies are better indicated in acute violent cases.
acute?
Violent acute cases. You will see some
Okay.
acute cases are progressing very slowly. Okay,
Hmm.
and you will see some acute cases are very violent.
Hmm.
103-degree fever, 104-degree fever, functional symptoms are very much prominent. In that cases, you need to have higher
Can
potency.
give. Okay. Okay.
Okay. We will discuss these all in detail when we will discuss the posology.
Yeah.
Okay.
Okay.
Thank
Okay.
you.
Thank you. Thank you, sir.